Are sex addicts sociopaths? Well, that is a big Google question, okay? And it's in our Facebook periodically as well. Big topic, we're gonna cover it today, and stay with us on that. I want you to subscribe to the channel if you haven't, because if you're a partner of a sex addict, you need lots of information. We have over 500 videos to help you. And also, if you have a question, please put it in here. If you are a sex addict, there's lots of help for you as well. And find out if you're a sociopath, okay? So let's talk about this. Now, I want to, before we get in this conversation, talk about addictions and disorders because they're different, okay? Now, the problem is the way the spouse is experiencing them is exactly the same, okay? One of the big questions we get is, Dr. Weiss, is my husband or wife a narcissist? Are they a sociopath, okay? And now, disorders are different than addictions, but however, they do feel the same in this way. A disorder like sociopath, the lack of empathy, all addicts have lack of empathy. Why is different? The sociopath has a lack of empathy because of a psychological disorder, okay? It's like they're almost missing a chip. A sex addict without a disorder has a lack of empathy because they're about 12 to 13 years old emotionally, spiritually, and morally. So they honestly don't see it. Now, however, the sex addict, when sober, will grow out of it, and the sociopath will not unless they do a really lot of hard work, okay? Does a sex addict and a sociopath share that lack of empathy? Absolutely, okay? But again, because of immaturity versus disorder, okay? Will a sex addict use and lie to other people like a sociopath would? Yep. But again, a sociopath is doing it out of a disorder, and an addict is doing it because they're 13, 14 years old, they're in high school, and they want to do what they want to do, okay? Using people is really a part of it. Lying to people is really a part of it, okay? Go back to that's what happens when you're not really spiritually, emotionally, and morally mature. You act like an adolescent, and you think like an adolescent, but again, as an addict, there's lots of hope they can grow out of it. Now, before I go any further, let me tell you where I'm coming from. For over 35 years, I've been treating sex addicts. I'm a psychologist, and I've been doing a 5-day, 3-day intensives for about 20 of those years, and for most of those 20 years, I've been doing psychological testing. So I've been testing sex addicts as to whether they have psychological disorders. And very rarely does sociopath come up. Even rare does narcissism come up, although the spouse is experiencing every single one of those symptoms. So it's confusing because she goes on Google and she looks down the list, okay? Does a sociopath use an alias? Does a sociopath take advantage of people? Yes. Do addicts go online and say they're Joe and their name is Jack? Yes, they lie. Do addicts deceive men and women into having sex and pretending that there's somebody else, that they're not married, right? They do, but they do it to get their drug. They don't do it because it's just fun and entertaining to manipulate people and they get pleasure out of it like a sociopath might, okay? The motivation is different and the origin is different, okay? So if you're going down Google and you're finding out if your husband is a sociopath, you might be finding out that they're an addict. And those are different. And now the good news is if they're an addict, they can grow out and mature out of it. If they're not, they really need professional care that specializes in that disorder, okay? Usually they attack one symptom of the disorder at a time. Now, can someone be both? It is possible, okay? But generally sociopath and narcissist, and I'm talking about, I have tested hundreds and hundreds of sex addicts and their wives, okay? And just like with the wives, about 80% come up with histrionic features, okay? And some with even histrionic personality disorder. But it's based on the trauma. Their irregulation is based on the trauma, not based on the personality disorder. And in the same way, ma'am or sir, if you're living with an addict, I validate everything you've read on Google is true. You are experiencing all of those symptoms. And let me tell you, the partner betrayal trauma is real. Your PTSD, the depression, the anger, the hurt, the betrayal is real. Get the book, Partner Betrayal Trauma. It validates statistically your pain, okay? And definitely get in a group, call our office, find out what resources there are for you if you're a partner watching this, okay? And if you're an addict watching this, hopefully this gives you help. Now, if you've been accused of having a disorder, go get a psychological test, which will verify that you do or don't have this disorder. I can't tell you how many couples have flown in for 5-day intensives and they're, diagnosing bombing each other. She's the borderline and he's a sociopath, and she's a narcissist and he's bipolar and all this kind of stuff. I'm like, you know what? I don't see any degrees after your names. You're not really qualified to do what you're doing. And to be fair, we're going to take both of you, do a psych test on both of you and make sure what truth is, but the test is going to decide which names you get to call each other. Okay? Because I'm not going to call you those things based on your spouse's interpretation. But if it shows up on the test, which another psychologist does, not me, then I will be fair, let's have that conversation. And I've had those conversations over the years many times where there is actually a legitimate disorder like schizoid or borderline or other issues like that. And we have to talk about them. And there's no issue with seeing both at the same time. However, before you, couch chair diagnosis somebody, either go to school for 10 years like I did, or go get a psych test. It's not that expensive, generally speaking, okay? And it will help you to solidify, because if there is something that needs to heal, you want to know. Now, sometimes you'll have features of something. Now, if you're a couple, what I really encourage couples to do is they both take psych testing. Even if you think you're perfectly wonderful, healthy, great, because then you can be guilty of being perfectly wonderfully healthy, okay? But sometimes there's a feature over here and a feature over here, and they're just ticking each other off. And in marriage counseling, it's good to know that, okay? If someone really has issues with being abandoned and rejected because of features, and the other person's like an intimacy anorexic, and what they do is abandon and reject and push you away, you can see how these features are going to mess with each other. So before you go diagnosing through Google, Google is not a psychologist. Okay, Google does not do testing. All right, the criteria you're reading is legit. Your experience of them in that way is legit. The causality is undetermined. That's your responsibility to find out the causality. If you're the person being accused, take a test. If you're the person accusing, let them take a test. Pay for the test. So I just want to know, okay? Because Dr. Weiss says, if you're not that, there's a lot more hope. And if you'll just stop doing porn or cheating or lying or drinking, whatever it is, you could grow up and we could have a happily ever after. Okay, because that's the problem. But if you have two problems, you want to know that. So I want to encourage you, in this conversation, take it slow. Your experience is legit, but it doesn't give you the credibility to diagnose. Get that done professionally, and then make the steps you need to bring healing to the situation.